Welcome to The Explainer. So, you've made it through school, you've practiced in the lab, and now you're about to start your first shift. It's exciting, right? And yeah, maybe a little terrifying. Today, we're going to give you the mental map you need to walk onto that floor and confidently prioritize patient care, from your very first assessment all the way to a full-blown crisis. This right here, this is the question you'll be asking yourself constantly. And to get it right every time, you need a solid framework in your head. So to build that, we're going to cover your professional foundation, how to navigate the system, how to master prioritization, delegate with confidence, and even how to lead in a crisis. All right, let's start your shift.
First things first, before you can even think about caring for your patients, you have to get your own professional house in order. This isn't just about skills, it's about your responsibilities. And it all starts with accountability. This is the absolute, non-negotiable bedrock of your entire practice. So what does this really mean? It means you own your actions. You admit when you make a mistake, and you always work within your scope of practice. And why does this matter so much? Because this is where trust comes from. It's the foundation of patient safety. It's what lets you practice with real integrity. And believe it or not, you've got to be a leader even on day one. Understanding these different styles is so important. You'll see them in your charge nurses and you'll start figuring out your own style. Think about it. During a code blue, you need that authoritarian style for clear, fast commands. But for planning long-term care, a democratic approach, getting input from the whole team, is going to lead to much better outcomes. Okay, now let's zoom out a little and look at the environment you're actually working in. The system itself really shapes how you deliver care, so knowing the model your unit uses is crucial for understanding what's expected of you. You can think of these like different ways to run a kitchen. Functional nursing, that's an assembly line. One person does all the vitals, another person does all the meds. Total care, you're like a personal chef, responsible for everything for one patient for your whole shift. Knowing which kitchen you're in tells you exactly what your job is. All right, let's get into the real meat and potatoes here. This is the core of your clinical judgment. I'm telling you, mastering this section is absolutely essential, not just to pass your exams, but for every single shift you will ever work. This right here, this is a huge must-know for your exam. It's giving you your 3 essential tools for prioritization. Think of these as your mental checklist. When everything feels urgent and chaotic, these frameworks give you a logical, repeatable way to make safe decisions when you're under pressure. So you're going to take every patient need and slot it into one of these categories. And the why behind this is so simple. You have to fix what's going to kill the patient first. Airway, breathing, circulation issues, those are high priority because if you don't deal with them, nothing else matters. And never forget, you have to assess before you act. Always. Okay, this is a classic exam trap, so pay close attention. It's all about knowing when to use ABCs versus CAB. For almost every single situation, it's airway, breathing, circulation. But the second you start CPR in a patient with no pulse, that priority flips. Why? Well, because the pump, the heart, is broken. The only way to get oxygen to the brain is to start compressions immediately. So for CPR, it's CAB. So let's try it. You've got these 4 patients. Who do you run to first? Using our ABC framework, that first client with shortness of breath has an acute B breathing problem. That immediately puts them at the top of the list. The other patients are either more stable or have issues that aren't immediately going to kill them. Number 1 is your priority, no question. Look, you can't do it all yourself, and you're not supposed to. Safe delegation is a skill, and it's one that protects your patients, your team, and your own license. It is not about just getting rid of tasks. It's about assigning the right task to the right person for the right reason. Remember this number, 5. That's it. This number is your key. It's your mental model for delegating safely and effectively every single time. And here they are, the 5 rights of delegation. This is another one of those absolute must-know concepts. You got to ask yourself these questions every time. Is this the right task? Are the circumstances right? Is the patient stable? Is this the right person for the job? Did I give clear directions? And, this is the one people forget, did I supervise and follow up? It's a complete circle that keeps patients safe. This table is pure exam gold. You have to know who can do what. What's the biggest difference? The RN handles the unstable patients and the core thinking parts of the job: assessment, planning, evaluation, and teaching.
You can never, ever delegate what you can't delegate, your own clinical judgment.
All right, let's head into our final section and put all this to the ultimate test. Because when a real disaster strikes, the rules of prioritization, they change dramatically.
The key phrase here, the part that changes everything, is maximize the number of survivors. In a mass casualty situation, your goal flips from doing everything you can for one person to doing the most good for the greatest number of people.
Red tags are priority number one. These are the people with critical injuries who have a really good chance of making it, but only if you get to them right now. You're looking for that sweet spot of most critical and most salvageable.
Yellow tags are your second priority. Yeah, their injuries are serious, but they're stable enough to wait while you're treating the red tags. They can hold on for a little while. And finally, green tags. These are the walking wounded. They definitely need care, but their injuries are not a threat to their life or their limbs. They'll be treated after the more critical victims are taken care of. This right here, this is the key mindset shift you have to make. On a normal day, you might spend the most time with your sickest patient. In a disaster, you spend your time on the sickest patient who can actually be saved. It's a tough calculation, but it's all focused on survivability. So, from your very first patient on your very first shift to a chaotic disaster scene, these principles, the ABCs, the 5 rights of delegation, that survivability mindset, they're going to be your guide. Prioritization isn't just something you memorize for test. It is a dynamic skill you build with every single patient you meet. So keep practicing, keep asking questions, and you'll be ready for whatever comes your way.